I first learned about tuberculosis growing up in a small town in Nebraska. Tuberculosis, or TB for short, became the topic of discussion in my town one day because there's actually cattle at the farm where my dad worked at that became infected with TB. At the time, I didn't think much about it. I only knew from my dad that TB was a disease that can make cows very sick. But other than that, being a little boy, I didn't care much about it. But fast forward 15 years later, I now study TB on a daily basis. And I learned that TB doesn't just affect cattle, but it's a major, major global health problem. So let me start with why TB remains such a public health challenge and why my research on tuberculosis matters. In the last 200 years, it's estimated that TB has killed more than 1 billion people. That is over 1/8 of today's global population. It has killed more people in this time frame than other major infectious diseases like smallpox, cholera, HIV, malaria, plague, flu, all combined, which are some major infectious diseases you may be more familiar with. And in the years leading up to the COVID-19 pandemic, it was still the leading infectious cause of death, killing more than 1.4 million people and causing over 10 million infections per year. Tuberculosis is primarily a lung disease, mainly impacting the poorest people of the planet, because it really is a disease of overcrowding and unequal access to care. It all starts when a patient with active tuberculosis coughs up the bacteria and someone breathes it in, causing them to be infected. We know that around 2 billion people worldwide are estimated to be infected with latent tuberculosis. Luckily, or just only 1.4 million of these people die, but still, it's just way too many. Despite the public health relevance and importance of tuberculosis, many countries, particularly low to middle income countries, do not know the true burden of TB within their communities. At the global level, it's estimated that only about 60% of all infections are detected by surveillance systems, and detection is even worse for mortality. It is thought that in many parts of sub-Saharan Africa, only about 30% of all deaths, regardless if they're caused by TB or not, are actually detected by registration systems. To provide an illustration of this, the map here is showing how well countries are performing in their vital statistics and registration systems. As you can see, in many parts of Africa and Asia, there is either no systems in place, or the systems are performing at a very low level. And in the very rare case that there is data available, it's often of very poor quality. For example, due to stigma associated with other major infectious diseases like HIV, for instance, many countries actually misclassify HIV deaths as TB deaths, creating huge issues for trying to understand the true burden of TB, but also for trying to understand the burden of other major infectious diseases as well. In the absence of robust data, I'm collaborating with a leading global health research institute called the Institute for Health Metrics and Evaluation, and with over 300 tuberculosis experts and policymakers worldwide. In these collaborations, I'm leading the modeling efforts to estimate the burden of tuberculosis for every country in the world. The goal of our research is to provide evidence so countries can implement data-driven interventions so they can eliminate TB within their communities. To this end, I'm leading work that leverages advanced machine learning algorithms with complex mathematical modeling using over 25,000 sources of data to estimate TB incidence and mortality for over 240 countries and territories from 1990 to the year 2020. To provide an illustration of the types of data that I'm working with, the figure here shows how many data points we have for tuberculosis mortality worldwide. As you can see, we have data in many parts of the world, but unfortunately, again, where TB burden is typically the highest, which is in parts of Africa and Asia, there's little to no data. This is why we're leveraging state-of-the-art data analytics that borrows information from surrounding countries, but also from 20 highly predictive covariates. Utilizing these methods, we can transform this partially data-sparse map into a new and complete map like this that provides robust and validated estimates of TB burden across space and time. Our work to date has provided significant results for trying to understand the burden of TB at the global level. For example, we're finding that there's been such stagnant progress in reducing the burden of TB that the number of annual infections today are actually the same as they were 3 decades ago. Further, we're finding such alarming increases in the prevalence of drug-resistant TB that drug-resistant strains now account for over 10% of all TB-related deaths today. And lastly, our results are confirming that TB is primarily concentrated in low-resource settings, as we're finding that around 80 to 90% of all cases and deaths are occurring in low-resourced areas. And I'll conclude with one last point of why my research on tuberculosis matters. As we have seen, TB is a disease disproportionately affecting the poorest people of the planet. In the span of this 5-minute presentation, it is estimated that there are 100 new cases of TB and that 15 people have died due to the disease. Our work is critical because it's providing countries with robust metrics and data so they can end the TB epidemic within their communities and ultimately at the global level. Thank you.